Can you stay active and be pain-free if you're suffering from spinal stenosis? The answer is yes. You can stay active and you can be pain-free if you're following a plan and structure and understand what works for you and what doesn't. In this video, I would like to share with you my online client's results, Jose, who lives in USA, and he's started his rehab plan 2 weeks ago with me, and he's been suffering from low back pain for the last 3 years. In this video, I would like to share with you his results, that how's he getting on, what we've done with him over the last 2 weeks, and he's going to share his story. I believe if you're suffering from spinal stenosis or if you're suffering from disc bulges, this video can be hugely helpful for you to understand. Yes, you can stay active, but if you have plan and a structure and somebody who coaches you, it can be much, much easier. Let's get started. If you've never been in this channel, my name is Bob. I'm a physical therapist, and the purpose of this channel is to help people like yourself with simple tips and exercise for quicker recovery. If you're suffering from chronic lower back pain, disc bulges, disc herniation, sciatica pain, or spinal stenosis, or any other type of lower back pain, I'll be happy to help you to recover with simple tips and exercise plan through an online program, and you can start this plan right away. I help many of my patients online all around the world through a rehab plan online, and you can literally start your plan right away. You can watch the testimony of these clients underneath of this video and have a look at see what we do in the online program, and you can get an idea if that's something that you would be interested to get started. You can always contact me through my email and through my website, and we can go through a discussion. What would be your plan for your recovery to get pain-free? Make sure to subscribe my channel for my weekly update, and don't forget to press that like button.
This is like a 2 weeks plan that you've started 2 weeks ago with me, and I would say, like, right now I'm so excited to see your results, man. It's mind blowing because you've been struggling with lower back pain for quite some times, right?
Oh,
Maybe
yeah.
just, Jose, in your own words, you share with people what was the pain, what happened, how long you struggling with this pain, and just maybe share with them since you started to this routine 2 weeks ago up to now, how are you getting on so far?
All right, so it all started having a work-related injury at work by doing a weirdly move. And so it developed to, I was not progressing. I was just getting worse and worse throughout the time. And for almost 3 years of dealing with, chronic pain, I've done numerous of chiropractor care, physical therapy, but I never had an exact structure of a rehab, plan to recover. So following you, Bob, for 2 years, I've been following you, and I've been seeing a lot of videos of how, of people's journeys and stuff. And one person that really spoke to me is the guy named JC from the Philippines.
Okay.
Yeah. He was like, he was giving his, his journey story, and, stick to the plan, whatever, just encouraging, be consistent to it. And what really made me is to contact you, message you, and I was like, hey, Bob, like, I'm struggling with this. And then after, I was having so much anxiety, like, basically you were like my one chance, to just like, okay, this is my last resort. I'm gonna contact Bob, even though we're like half away across the world.
Exactly. Where do you live, Jose? If you don't mind, just share with people.
I live in Sacramento, California, in the United States.
Yeah.
So we're like a day ahead, 8 hours ahead.
I know what I mean. Yeah, exactly. Yeah.
And so, after hearing people's journeys and then how they got pain-free, I was like, all right, I gotta contact Bob. And then, from where I started from 2 weeks ago till now, it's like a major, huge difference, where I'm not necessarily where I'm at right now, but it's getting there.
Of course, 100%. Yeah, 100%. Maybe just, Jose, just explain for you what for the guys, like, what was the problem initially? What was the diagnosis? What they did diagnose from your back, and what they told you you should do or shouldn't. Maybe go back to the type of treatment that you got and how did you find them initially?
So I had an L4, L5 bulging disc. It was a 5 millimeter.
Yeah.
bulging disc, and with spinal stenosis,
Yeah. Yeah.
the canal was smaller.
Yeah.
Over
That's a
the course of
congenital. You have a congenital, basically
it,
spinal canal stenosis. Yeah.
yes, and then I also had bertolotti syndrome, which is
Yep.
that birth defect, congenital birth defect that I was born with.
Yep.
Um, and so people, well, not a lot of doctors for sure don't know what bertolotti syndrome is. But however, doctors would tell me, well, this is what you have. We can give you an epidural shot and then call it a day. There
Got you.
was no structure of like I said before, there was no structure of what to do. And especially with the doctors that I'm with, they just tell me that, you're gonna be better. You're not gonna have no surgery. You get better over time.
Got
But
you.
there was no plan.
I get you. I get you.
Um,
And they
and
just tell
so
you maybe some exercise to follow for a while.
And they throw me some exercise for a while, but it was just random exercises. I couldn't, you know, I wasn't sure what was helping or what was.
Or wasn't? I
And
get you.
so, and that was the biggest struggle in my
And did you end
journey.
up ever get any injection? I suppose.
No, no
Got
injections.
you.
I kind of just lived through the pain and
Yeah,
kind of just mask it. And
I
that's
get you.
until I found you and
And
everything's
what
changed.
was the level of kind of like what was the symptoms that you had before we start your routine, Jose? Like for quite some time, I suppose part of it was pain, but maybe just give people some feedback. What was it? Like
I had
how bad was the pain?
My pain, I had right foot numbness and left foot numbness,
Hmm.
leg pain on the left side, sometimes on the right, lower back pain where it throws off my mobility. There will be times where I get up from this chair right now, I'll be really stiff, like I'll be walking like I'm almost like 80-year-old.
Get you. I get you.
But since that since I started rehab that program, I was just more like, okay, after starting it, I was able to get up more comfortably without feeling any stiffness. And my right side has definitely stopped, numbness,
Amazing.
everything. And then left side is in the progress, but it's
Of
getting
course,
there. And,
improving.
everything else is just really improving. It's
And
all
how would you?
timing.
Yeah, how would you rate the pain in comparison to what it was and what it is now?
From then it was almost a 10 to a 12 or maybe 15. And then versus 2 weeks, versus now it's like almost a constant two or three. So I'm
I get you.
fluctuating, but it's not severely close to a 10 where it throws off my mobility.
Of course. Yeah,
Yeah.
you're still functional and still working. I suppose you walk around, etc. Jose, the first week when we were discussing today, the first week was a bit challenging when you start the routine.
Yeah.
What did you kind of like maybe share with people? What was the feedback of first week? Like, how did you feel like when you start to exercise? Because you didn't do those exercises, and some of these exercises were kind of like mentally were challenging for you because you never done them before, and you hear a lot of
Mhm.
bad things. Should I do, let's say, squat, for example? Maybe just share with people how was your perspective in terms of doing doing squat, let's say.
The first week during the exercises was definitely challenging. I was feeling so anxious about
Yep.
doing these exercises, especially the deep squat,
Yeah.
because in my head, in that deep squat, I'm squatting and I just felt like something is coming out of my disc.
Yes. Yes.
And and I remember correctly, I was messaging Bob like, "Hey, is this correct? Am I doing the right way? Because I'm scared that this will blow out."
Of
But
course.
overall, like that first week, it was just a lot of anxiety, anxiousness because my body's not used to it. My body was not used to
That's true.
doing those exercises. I never done an actual routine based exercises, and
Correct.
I just had to trust myself and trust Bob in the process, and you know,
Absolutely, absolutely. And the second week was much more, I suppose, easier for you to carry on with it. And the pain was hugely different from the first week.
yeah. The first week was rough. Second week, it was just like, okay, I'm seeing some major improvements. Uh, you know, the first week your body will start tripping out like crazy, and then the second week, like, okay, this is feeling better, and you definitely
you see changes.
Yeah.
Jose, what do you think really helps in this routine or overall? Because the initial consultation that we had, I suppose you had a lot of question in your mind. Okay, what you should do, what is the problem, and what is going to be the road of recovery. What do you think it does hugely help you? I mean, to get to this level. I mean, we're not done with your rehab. We're definitely going to share more progression. I would love to get you back to the gym and get you train again. You know what I mean? And I think that's something that get you to the next level. But I want to know, in this stage, what do you think helped you the most in regards to your recovery?
I think what really helped me was having trust in you. And that really kind of just built my confidence more, because I never, honestly speaking, like I never had that person where it can guide me. you know I message you, you can tell me like, hey, this is correct, like just constant reassurance that you gave me. um Another is like basically just trusting the process. And one thing that I kind of had another realization is that everyone's pain is different and everyone's road is different. And um just have confidence in yourself, and then we'll see where it
Amazing.
goes.
Amazing. And I suppose like have a bit of kind of like a planning that you follow in a day-to-day living. Do you think that is helpful, that you're following something as a structure that give you, okay, you have to do this today, you have to do this today, and this is like Monday and X and Y, and tracking things in a day-to-day living, like your daily activity, like your stress level, for example, or your sleep level. Do you think those things are helping you to understand, okay, I'm having a bad day? It's not necessarily I haven't done anything bad to my back. I'm just
Yeah.
having a more stressful day, which is normal in life, right? Do you
Yeah.
think those things are helping you to understand and analyze the pain better?
Yes, yes. When I'm more stressed out, I think it's more, if it will start getting more pain. If I start feeling more pain, it's because I'm stressed out.
Of course.
So I I have to relearn my way of, doing some breathing exercises to just relax that nervous system
Exactly.
and reset it. And, you know, I'll try to just find something that will distract me from the pain,
Amazing.
and just to not think about it and just release some of that pain out.
Of course. Yeah, distraction is a huge factor, which
Mm.
hugely help. You're damn right. But Jose, is there anything else that you would like to share with people? Because I'm delighted with your results, man, so far, and like you've been doing really great. Like, I mean, you're a totally different person from 2 weeks ago, man. Like honestly, like when I see like you were very anxious and you were really panicked 2 weeks ago when we chat, and today you're like, if you rate your confidence about your back, how would you rate that?
I'm rating it right now 8, but it's going to 10 soon.
Amazing, man.
uh,
I'm delighted with that, man. Anything else that you'd like to add on into what we?
uh, if you have any pain or suffering from anything, contact Bob.
You're the
He
man.
will
You're the man.
get you a plan. And just
100%, man. Yeah, 100%. I would be happy to help. But I think one of the things that I was discussing earlier with you, that many people contacting me and they asking like for help in regards to their injury, but like in regards to the initial consultation, I think one of the things that we go for more than an hour we talking is like for me to know you in details. What do you do? What's your lifestyle look like? What's your pain look like? What you've been doing about it? And what's your work? And understanding all of those hugely helped me to understand how I can help you with a customized plan that get you back in some sort of recovery. But I just want to know, do you think having that 45 minutes to an hour initially in initial consultation help you to describe your lifestyle is a huge factor? In my opinion, that hugely helped me to know you. But do you find that helpful to tell your story to somebody like me as your physio?
Oh yeah, definitely. I mean, honestly, you just gotta be really honest with what you do in your life, and then that way we can understand where your pain is coming from, and then for you build a plan. With me, it was obviously, I had to tell, okay, I work at Starbucks. I work 8 hours in my feet every single day. I
Exactly.
move around and everything, and then okay, well, we'll figure it out, and then this is my pain levels and stuff like that. And you
Absolutely.
know, obviously diet, everything, just kind of just get to know you. Like I had to describe you what my life really is right now to you.
Absolutely. Yeah. And that's why I think, like, you know, for me to know my patient is a huge factor, I suppose. And I suppose like we had a chance to go through that, and I'm looking forward to update more and progress from your plan, Jose, in future. Get you back in some hobbies that you like, not necessarily gym. Gym is something that is optional, but something that you like to get you more, I suppose, fitter and stronger in whatever you do. Is that fair? Anything else that you like to share, Jose?
No, just trust the process. That's it.
Thank you, man. Thank you, man. Listen, I'm delighted with your progress, and I'm looking forward to keep pushing you forward.
Thank you for watching this video. I hope you guys find this video helpful. If you have any question regarding your injury, leave me comments. If you need further assistance, as I mentioned earlier, we can organize an online consultation for you to go through your case in details and get an idea of what you can do for your recovery. I help many patients online all around the world through an online plan which is simplified and is detailed, and you can literally follow steps for your recovery to become pain-free. Make sure to have a look at my videos, send me a message, send me an email, and we can definitely have a chat and see what can be your recovery road, and I can explain for you what steps you have to take. If you have any further question, leave me comments. If you haven't subscribed my channel yet, make sure to subscribe and press that like button. Until next week, all the best.